My name is Jacqueline Roach, and I am from the Yankton-Bonhomme area. I attended SDSU, and then I met my husband, who is from Brookings, and now we live here in town. I teach first grade over at Sioux Valley. So we had Renly in October, so she's 8 months old. She's a very happy little and healthy little girl, and now she is moving all over, very inquisitive, and also developing a very silly personality. So I'm very lucky I get to be home with her this summer. So after talking to others that we've known that have had experience, that played a big role in our decision, and just hearing how overall their experience was. And then also the updated facility, and most importantly, just the location, everything being in Brookings. So as first-time parents, my husband and I just going into it and knowing every experience is different, so we really wanted a little more support when we looked at our team, and knowing the support that we would get from the hospital staff, but the support that we'd get from the doula service, and then knowing Ellie, knowing she was perfect for the job. I was about 38 weeks, 39 weeks when my first symptoms showed up, and my first symptoms were in the middle of the night. The bottom of my feet were so itchy, no rash, nothing. Wrote it off for a couple days, and then I finally messaged Dr. Bennis, and I was like, hey, I think this is more than maybe just being really pregnant. And then she had me come in and do blood work. She had said, yep, your blood work's kind of showing that you might have this. We'll talk more at your appointment. And then at my appointment, my blood pressure was also really high. So cholestasis is a condition with the liver, and then it affects like the bile moving through your body. If it's not transferring through your body, then it is getting in your bloodstream. So it has effects on the baby, and then also for the mother. We talked about scheduling the induction. So I was pretty ready to be done. So I was like, yep, I'm okay with scheduling that and moving forward. Thursday morning I woke up and I just felt that crampy. So as a first-time mom, I feel like I really put the blinders on everything. I was like, no, this probably isn't contractions, not it, but it was. So when we waited at home and labored at home, and then when we went into the emergency room for our induction, and then once they hooked me up, they're like, oh yeah, your contractions are 2 to 3 minutes apart. We're here. So then they just had to give a call to Dr. Bennis to kind of change the plan for the induction, because I didn't need to do the full thing. They were all very comforting. I think the whole process of getting checked in the evening, it was very relaxed and it was very calm. So we checked in. Our nurse Megan was amazing, and she assisted and supported in getting anything we needed, getting the bath ready. That was my favorite part. But I felt it was very calm for what I thought going into it. For me, I knew the care team, their focus would be me and baby. So for Carter to feel supported, we were the doula was a good coach. Not that she took over any role from him, but she was able to coach him through whatever he was ready to participate in. The staff was really great. It was a lot more calm than what I thought. It would be more chaotic and more people come into the room, but the whole time it was just there's a lot of teamwork. It was very collaborative, and it really was a calm experience. Everyone was really excited to celebrate a birthday that day. They did a really good job of informing us, but also I feel not in telling you everything as in to overwhelm you. It was at our level for not being in healthcare. They did a really great job. Our minds are elsewhere, so Ellie did a really great job of when those would come up, of communicating what our choice was, and then the care team also did a really great job of respecting those choices, and everyone was very supportive. There wasn't any back and forth through that. Like our support, we felt advocated for, but we also felt very supported and respected. So that was a big reason why I wanted to wait as long as I could for the epidural, to do as many positions during labor. So while I was at home, I was in communication with her, and she's like, keep walking as much as you can, bounce on the ball. And then when we were here at the hospital, our nurse Megan had said that she had just completed spinning babies training. So she had offered to help with that, and I said absolutely. So we did some of those techniques. It was a lot of walking. Then the peanut ball, the props kind of came into play. Once I had the epidural, we were still doing a lot of sideline positions. And then when it was delivery time, that's when I kind of finally was sleeping, and they woke me up and were like, it's time. And then Renly came really quick. So I think between the whole process of just continuously moving was really beneficial. So we chose to use an alternative birthing positions just because kind of research into the body and the female body and anatomy, knowing that when you traditionally are pushing on your back due to probably having an epidural, just your birth canal isn't for baby the best suited. So that's why it was really important for us using the different birthing positions throughout labor and delivery. And I think having that mind-body connection and some of those other positions helped her come a little quicker for us. Yeah, so we did choose to breastfeed, and we just knew that our supports that were in place between the nurses here at the hospital after giving birth, we utilized Baby Cafe, and we had a really smooth experience, but a fed baby is best. So we also felt very supported that if we changed plans at all, that we were comfortable and okay with that too. I would tell others that if you want a knowledgeable and supportive staff, that Brookings OB is definitely the route to go and a great facility to be in. I feel that just throughout our experience at being in different areas of the hospital and different departments, that everyone, it's just the same quality care throughout. Everyone's been very kind and helpful and supportive. And it's all right here in Brookings. That you can't get much better than that.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.